Welcome to Chapter 7A, Adolescence. I should mention that this was the chapter and slide that marked transition from my regular face-to-face teaching in this class to fully online during COVID. And we've come so far now. We have a COVID vaccine easily accessible. Unfortunately, not everybody takes advantage of it. Some people are confused that COVID vaccines or flu vaccines prevent the disease. Neither one do. They just keep you out of the hospital, off life support, and alive. But in any case, this is our chapter on physical development from puberty to age 18. Until fairly recently, in the last couple of years, I would have said puberty to 20, but now Elkind's concept of emerging or emergent adulthood has fully taken strength, and so we will stop this particular age range, adolescence, at 18, and at that point, emergent or emergent adulthood will pick up. So we're off and running. On this slide, we're going to consider two very different conceptualizations, in other words, views of adolescence. One is probably what you view it to be, and we might be surprised to learn that the way we look at adolescence is not universal. G. Stanley Hall, who you might remember as being an early great developmental psychologist, also first president of the APA, studied the time of adolescence and used his German phrase, Sturm und Drang, to conceptualize it, meaning storm and stress, that moody, petulant, difficult, where the adolescents find themselves and maybe railing its parents or structures. In Western society, this is considered to be universal, but it is far from it. So in industrialized nations, including ours, there's typically a very extended period between childhood and adulthood where the person's not an adult, not a child, does not have the adult responsibilities. It's often considered a time of a certain amount of rebelliousness, a certain amount of exploration. And again, not expected to take on adult roles. In tribal societies, there's just a very brief transition period between childhood and adolescence. The individual quickly takes on adult responsibilities, adult roles, and forms an adult relationship. I remember as an undergraduate reading one of Margaret Mead's books. She went to live amongst the Samoa, and you can see her dressed in native garb, and lived amongst them and observed from the inside. We learned about participant observation in the earlier chapter when we covered our research methods. So really bring it to our focus that the Western way is not the only way of experiencing or conceptualizing adolescence. It might be a good idea to start our chapter with a definition of what middle childhood actually is. Generally, ages 6 to 11 would encompass middle childhood. It corresponds perfectly to some theorists' stages, others not so much, as we'll see. Let's now consider physical changes. The growth is now slower. So you might remember in early childhood, the child was doing about 3 inches a year, which still, if you think about it, still should amaze you. It is now slowed to 2 inches a year on average, but that's still impressive. Imagine what you'd have to do with your wardrobe in 3 years if you were growing 2 inches a year. Girls are now starting to exceed boys in both height and weight. So we think of the typical man being bigger and heavier and stronger than the woman, not during middle childhood. Let's now consider motor changes. Children at this age are now better at motor skills, both fine and gross. We should also note that PE classes, phys ed classes, are not sufficient to keep a child well exercised and healthy. If you consider the number of schools in our country that have daily PE classes, it does peak in middle childhood, but that peak is a mere 8%. Far fewer schools in early childhood or senior high schools have daily PE. You should also note that 1 in 4, almost 25%, have no PE classes whatsoever. And again, PE classes are not sufficient to maintain exercise with a child that's not exercising sufficiently outside of it. But with no PE, obviously it's a more serious consideration. Most children in middle childhood simply are not active enough. Far fewer walk to school now than previous generations, and there's far less playing outside. How could they? They're busy texting. The average child in middle school is on social media roughly 5.5 hours a day. That leaves little time for the physical adventures and physical activities of yesteryear, and we'll tie this into various considerations, including increased anxiety, increased depression, and increased obesity. And you might say, well, what's wrong with using your phone and walking? Not safe. We know texting and driving, not safe. Walking and texting, not safe either. Let's now consider the hormonal changes associated with puberty. Puberty itself occurs in 2 phases. The first phase, hormonal changes in both sexes cause a growth spurt. In the second phase, hormonal changes will cause sexual maturation and secondary sex characteristics, which will be discussed in a soon-to-come-up slide. The sex differences between boys and girls in terms of puberty. Girls obviously begin a little bit earlier, 8 to 14, versus boys 9 to 14. For girls, it begins with addition of body fat. Once the body fat to muscle ratio reaches a certain tipping point, that will cause endocrine changes, causing her to begin cycle until she hits menopause or pregnancy. For boys, it's not the fat, of course, but the addition of muscle mass. So we just learned that the average range for girls is age 8 to 14, and for boys it's 9 to 14. But what is actually the average age? For girls, it's 12 and a half, somewhere between leaving elementary school and early junior high, versus boys, the numbers have been recently revised from average age of 11 to now the average age of 10. That's 4th grade. That amazes me, and that's not necessarily at all a good thing. Let's consider brain development in the teen, in other words, the adolescent. And much of what we say is also true about the young adult in the early part of young adulthood as well. The limbic system is our emotion center. It's fully completed, whereas our cerebral cortex, our higher brain, is still a work in progress. That means the cerebral cortex is not fully up to doing its function, and one of its major functions is to control the limbic system, to control the emotions. What's the result of this mismatch? Powerful emotions. The emotions of the adolescent are much stronger, whether it's fear, anger, depression, joy, much more intense than they'll experience in later parts of their life. It will also result in changes in their ability to think and how they think. Maybe as a review, I might mention that the neurons, there are no neurons, maybe well, currently research is finding tiny, I keep saying tiny neurons are possible, but in large, very, very, very few neurons are added past the first year of life. We're more or less born with the neurons we'll have at birth. The changes in the brain that are going on during adolescence are in particular increased myelization and increased synaptic pruning. So hopefully I didn't confuse you, but for intensive purposes, think of the brain having its complete number of neurons at birth, or at least within the first year, and beyond that point, we'll see a decline in neurons number, and that's a good walk away. Now, in terms of the changes in thinking, we'll consider them in the next set of PowerPoints for the other part of this module. Let's now consider sexual characteristics, both primary and secondary. Primary refers to maturation of reproductive organs, so they directly lead to fertility. Secondary are the non-reproductive changes that are present in mature adults of any species, and they signal sexual maturity. So let's consider some of the secondary sexual characteristics. In girls, it would be formation of breasts. You might say, are they sexual? Breasts are found in mammals from anywhere from a dog, a horse, a zebra, or a person to feed the babies. In some human cultures, they have sexual connotations. In many human cultures, they do not. Our culture tends to be rather uptight in breasts. We have to have special feeding stations for breastfeeding. If you go to Europe, women breastfeed in public because they're feeding their baby. There's nothing sexual about it. It's kind of basically an American hang-up. Boys includes facial hair and voice changes. Adam's apple. For both sexes, underarm hair and pubic hair, which is impartially related to body odor changes. Children really do not have body odor. Adults definitely do. And for both sexes, there may be a temporary increase in acne. So these are these secondary sex characteristics. You'll see the two slides on the bottom also highlight some of these changes and adds on a few other details. Hopefully your transition was a smooth one. Let's consider acne. Hopefully this doesn't bother you and it's not a part of your life, but in case it is, here's some important information, or maybe it will be useful for your child or your sibling. You should also know that acne isn't limited to just individuals that are adolescent or young adulthood, but even in late adulthood, people can get acne. Let's start with basic forms. If you're reading about acne, you'll see the term hormonal versus cystic. And what exactly does that mean? Hormonal is sometimes called regular acne, and cystic are often used interchangeably. They describe different aspects of a breakout. Hormonal acne refers to the trigger of the hormones of the body, whereas cystic refers to the severity and the physical form. So cystic is often caused by hormones, but cystic is used when it is severe. Typically, it does not have whiteheads or less whiteheads. It will have deep, painful, raised areas. And it's common to have hormonal acne as a cause, but it manifests as cystic. Treatment, well, it depends. Regular/hormonal acne might respond to treatment systems that you've probably seen commercials for, such as Proactive, Murad, or Exposed. I went on to Amazon and priced them $56, $80, or $60 respectively for a month, 1 month of supply. If the regular hormonal acne doesn't respond, the person would need to move on to prescriptions. That would include the isotretinoin, which we mentioned before, oral antibiotics, or for very large cysts, maybe a direct steroid injection. Some birth control pills are effective, but only 3 of the many, many varieties on the market. Please also remember that if the isotretinoin is used, it can cause horrible facial birth defects in a fetus, so a very reliable method of birth control, preferably 2, should be used by a person who was possibly able to get pregnant. So again, your physician is often the best place to start getting information. Treatment is, of course, essential. Acne can cause permanent scars, both physical and psychological. Puberty for girls comes earlier than ever before. A girl's first menstruation, in other words, menarche, has changed quite a bit. If you consider back at the year 1900, 16 or 17. Today, average age 12, though the typical range would be 11 to 15. What's driving this? Well, quite a few factors, but primarily changes in body weight. Once the girl gets a certain degree of fat, it triggers endocrine changes, which trigger menarche and puberty. So we could also argue things like the hormones in all the products, especially chickens, and greater health, and greater health care, and greater nutrition. But all in all, it's just the body fat driving it. And girls that are obese go into puberty earlier than boys and the other girls. Can you remember what ACEs and HPA axis stand for? Take a moment and think about it. ACEs would be adverse childhood experiences, and HPA axis, let's see, was H hippocampus or hypothalamus? Was P pineal or pituitary or pancreas? What was the A? Hopefully you said hypothalamic or hypothalamus pituitary axis. Let's expand on the previous slide a bit. So why are girls hitting puberty so much earlier? The main reason is that they are reaching the needed body fat considerably earlier. And let's look at what factors impact this. Much greater caloric intake than the past. Much more sedentary. So with cell phones, activity that's used to be outside or active is more likely to be done on a cell phone. Less walking. Buses, even if you live in a block of the school, are very common. Less PE. We said 25% of schools have no PE, and PE programs, phys ed in and of itself, are not adequate, so there needs to be more activity. Hormones in food, especially chickens, that are put into the chickens artificially. Also, hormones and chemicals in the environment that mimic endocrine hormones. They're the endocrine disrupting chemicals. Stress also impacts puberty. So compared to even a generation ago, young people are reporting significantly more isolation. We know that individuals with high social media use show increased anxiety and increased depression. You could also mention fear of mass shootings is statistically low odds, but still you hear of it all the time. This is primarily an American thing. At the college this week we've got notice that we'll have our first, we do fire drills all the time. We're going to have our first practice mass shooting drill. Times are changing, not for the better in this area. And ACEs, consider what the letters ACEs and HPA axis stands for, and then after you've considered it, you can listen to the next icon and see if you're correct or not. We noted in class you're probably not so interested in the timing of your puberty. You've already done that and been there, but they also are linked to breast cancer and prostate cancer, as well as fertility issues. I thought I might ask you to do a little activity, which is very simple. Look at our list of 11 items and check off the ones that you are currently doing as bad behaviors. For example, using nonstick pans, not buying organic, etc. So list your problem behaviors and then look at the ones you identify as problems and indicate one or two or maybe three that you might be willing to switch and actually implement that in your life. You might even share with friends and families what you're doing and maybe bring them along too. This slide indicates that 1 in 8 women now will have breast cancer in their lifetime. Within my circle of female friends, 5 women that I'm closest to, 3 of the 5, which is more than half, are being treated or have been treated for breast cancer in the last 2 years. So I'm afraid that in another decade, the 1 in 8 will be a number that we wish we had. So again, anything that you can do to decrease your odds if you're a woman or if you have women loved ones is worth considering and trying to promote yourself or others. As we noted, one major reason why puberty appears to be occurring much earlier is the presence of EDCs, in other words, endocrine disrupting chemicals, and a particular subclass of them called the BPAs. Now, you can do very simple steps to decrease your risk. Washing hands before eating removes the chemicals from your hands and also good for coronavirus protection. Dusting and vacuuming often, preferably with something with with a HEPA filter. Apparently these materials escape from our couches and electronics. Avoid soaps with fragrances. The black eating utensils, I'm sorry, not eating, but cooking utensils, spatulas, spoons, and so forth, are often made with chemicals that are not human grade. They are recycled materials, and although recycling great, not for this purpose. Although it might sound better to use a metal can than a plastic bag, unfortunately, metal cans are lined with BPA materials or something that is so similar that it's actually not better at all. Frozen foods would be the way to go. Minimize plastic use as much as you can, and a big one, never microwave in plastic. I know many of the vegetables and other things, have you cooked right in the plastic bag? I've stopped doing that. That's a simple thing to do, and I'd urge you maybe to consider it also. Let's consider the next slide with more ways to avoid these EDCs. Let's continue our look at ways of avoiding EDCs. Buy organic if you can afford it. Select food that's processed as little as possible. So, for example, I gave you whole roasted chicken is better than McNuggets. If you take environmental science, you'll be given an activity with some teachers where you'll look at a food that you cook and compare it to the ingredients of a commercial one. The difference is amazing. Next one, avoid non-stick materials such as cooking pans as much as possible. Next one, consider water as a contaminant, so avoid buying and drinking water out of plastic bottles. At home, put into a glass or ceramic cup. If you're using a transportable container, use something that's not lined with plastic, something that's lined with metal. We noted that unhealthy cleaning products are a major source, and starting soon, cleaning products will list chemicals, so you can choose home-friendly chemicals. In addition to saving yourself, the image on the right indicates how much good you can do for the environment by avoiding plastic bottles. And consider the image on the right. I'm very fond of my Stewart's coffee, though I've switched into making it at home now. If you're placing in a plastic glass, consider how many that you would use in a year. The number is astounding. And again, it's much more environmentally friendly to bring your own container and have them fill it, which they will, as long as it's a permanent, not a recyclable glass like you see. Since I first narrated the slide, there was federal legislation that was passed in 2021 mandating that cleaning products now list their chemicals, and one way to make life easier is to go with the green chemical or green listed household cleaning products. Let's now consider the advantages and disadvantages of being an early or late mature and see how that interacts with the variable of sex. We'll start with girls that are the early puberty girls. So since girls enter puberty years earlier than boys, if she's an early maturing girl, she is hitting puberty before anyone. And overall, it's disadvantageous to her. So she will be noticeably taller, and whereas The rest of our people around her are children. She's becoming a young woman, so she's going to have breast development, so that can certainly be awkward and maybe the butt of bullying and teasing. She will have decreased self-esteem compared to the late maturing girls. She's more likely to be withdrawn and unpopular. She's more likely to engage in smoking, drinking, and earlier sex, and all the risks that go with earlier sex. She's more likely to have eating disorders, anxiety, and depression. And at least we can say that she is more likely to excel at sports, and sports have peers, identity, status, so that could hopefully be a compensation for her if she is athletic. Girls with later puberty overall have much better outcomes. So unfortunately, girls can't choose. Now, consider boys. Boys with early puberty tend to be more confident, have higher self-esteem, so he'll be more attractive to the girls that are already in puberty. He will do better athletically than his non-maturing peers, so he'll be better at sports and likely be more popular. So for males, distinct advantage; for girls, more or less distinct disadvantage, again, unless she's athletic. Boys with late puberty are the very tail end of everybody. They're more likely to be awkward, insecure, and sometimes more than other individuals, overly talkative. Might be drawn to attention seeking, and for all those reasons and more, may have increased risk of being bullied. So we see a considerable effect of sex versus the advantages and disadvantages of puberty, coming early versus late. Let's now consider adolescent sexuality. If you consider adolescence, make a guess. What percent do you believe are sexually active, using whatever definition of sexually active you wish to use? Is it 85%, 95%, higher than that? Let's see. In this figure, you can see a very nice linear relationship between age and percent having intercourse. Consider at 19, it's not quite 3/4 of individuals. So if you were thinking 85 or 90 or 95, you were a little bit high. Let's continue to look at adolescent sexuality. It's quite clear that the U.S. gives contradictory messages. Media is very sexual. Songs are often very sexual. And yet our families and schools are giving us a very different message. Now, in comparison to Europeans, who are less ambivalent, they don't have our Puritan history, Europeans have a much lower rate of sexually transmitted diseases, as well as teen pregnancy and teen fatherhood. In our country, many states engage in abstinence-only sexual education, giving no facts, with the idea that providing facts encourages sexuality. The research is very clear. It is not associated with an earlier age of sexual activity, but it is associated with a much lower rate of pregnancies and sexually transmitted infections. In our country, currently, 1 in 4 unplanned pregnancies would now end in abortion. Teen parenthood is also associated with a much higher rate of lifetime poverty, with many different negative effects for both the parents, particularly the mother, and the children. The mother pictured in the clip art should be perhaps happy her child is acting in a responsible manner. For all these slides, it would be more effective if you would read the slide before listening to the audio, so I'm going to encourage you to do that right now, including seeing if you can figure out what AIDS stands for, each letter of the acronym, and 3 ways in which HIV is spread. So 1 out of every 5 sexually active teens has an STI. In part, the number is so high because, similarly in adults, STIs are often asymptomatic, which greatly enhances their spread. Oral sex is actually riskier than most people think. Although it is a very, very, very low vector for HIV, it can and does spread gonorrhea, as well as other serious conditions like hepatitis. STIs can lead to sterility. In fact, they are a major cause of sterility, and can also lead to other life-threatening complications,
including, if untreated long enough, gonorrhea can lead to heart disease. Syphilis, if allowed to progress, can damage virtually any system of the body. STIs are also a major cause of blindness. I show pictures in my human sexuality class, but I didn't want to have a picture staring us literally in the face on the screen. But they are amazingly disturbing. If you're up to it, take a little picture, take a little peek on the internet, put in STI and blindness. AIDS is often acquired in adolescence, the age of most of my students. Were you able to figure out what AIDS stands for? Many students on tests put the word automatic. It is not automatic. It is largely preventable, at least in our country. It is acquired. I is for immuno. D, deficiency, and S, syndrome. So it's not the virus per se that kills, it's all the opportunistic infections. HIV can be spread through three means. One is blood. Whatever that transmits blood is a vector. Also sexual fluids. On a test, I would not accept vaginal fluids because that leaves guys out. So sexual fluids, blood, but could you figure out the third way? Breast milk. I do want to make sure that everybody that takes me as a teacher knows about PrEP. I've mentioned it before. This is a very, very effective medication if a person takes it reliably and avoids serious recreational drugs, crack, heroin, and things like that, amphetamines. It is nearly 100% effective in preventing the person from acquiring an HIV infection. If you call or check the Department of Health website, it is very expensive, but everybody can be given PrEP, so if you can't afford it and you think you need it, do contact them.
A recent innovation in HIV prophylaxis, in other words, prevention before you become HIV positive, is a new medication, Yeztugo, if I'm saying it right. The big advantage of this medication is, whereas PrEP has to be taken daily, the Yeztugo is an injection which is just done twice a year, and that allows much less room for slip-up versus missing pills.
Let's now consider obesity. Perhaps it might surprise you, but obesity is not listed as a disorder in the DSM. In Abnormal Psych, we have discussion in terms of whether or not we believe it should be. But in any case, obesity is often defined as the person being in the 95th or greater percentile for their particular body mass index. We know risk factors. One risk factor is inadequate sleep. It leads to much poor food choices. A major factor is parental food choice. Consider the theories of learning and which one do you think would agree the most? Would it be operant conditioning, classical conditioning, social learning, habituation, or maybe trial and error learning? If you want to say social learning, indeed, you are correct. In this case, the parent would serve as the model in which the child, the youth, would imitate. We also know as another risk factor, individuals in the lower SES, in part to poor diets, enhanced stress, less access to medical care. It's important to correct weight issues when the individual is young because children and teens that are overweight or obese are much more likely, as you can see, to be obese as adults and experience the corresponding health problems that are typical with obesity.
So what percent that are obese as children or teens will become obese adults? Upwards of 3/4, very close to 80% in fact.
Typically, as children get older, they spend less time with parents, eating other places, and diets become poorer. skipping meals becomes common and fast food consumption increases, the more time the individual eats with the family, it tends to be associated with a much higher, healthier diet.
Let's now consider risks for teenage mothers and their babies. A huge one is lower educational levels. Only half graduate from high school. With that goes lower occupational levels and, of course, less salary for themselves and the child, less or no father involvement, the likelihood of future teen pregnancy. Poverty for self and the child is much more common. More than 3/4 of unmarried teens need to utilize social welfare. They're also more likely to have pregnancy and birth complications. When the child is born, they have weaker parenting skills. Half of their children, at least, will have behavioral or school issues. And the child, particularly likely if the child is a girl, to repeat the cycle. So many negative potential outcomes. Let's now consider adolescent sleep needs, which might well be you. 9 to 10 hours is advised. How many actually meet their needs? A mere 1/3. What are the results of inadequate sleep, not meeting one's basic physiological needs? Much the same that adult would experience, only more pronounced. So increased moodiness, increased issues with anxiety and depression, which are already at current records in our youth. Impaired learning and lower grades. Think of that in terms of if you're struggling at school. Inadequate nutrition might be no small part of the issue. And increased risk-taking, whether it might be too rapid driving in the drug arena, sexual arena, or what have you. So if you're not meeting them, maybe make it a goal that you're going to add on a half hour, 45 minutes, or perhaps even an hour each month until you get within that 9 to 10 range. But remember, it is individualistic, so for some people it could be 8, for some people it could be 11, but most people of the adolescent age will fall in that 9 to 10 range.